Welcome! In this video, Dr. Karin Brischke of Random Walk Imaging has a chat with Professor Pia Sundgren of Lund University. She has used our proprietary acquisition sequences and post-processing software algorithms in her research. Enjoy!
Thank you very much for this possibility. It's always nice to talk to you, Karin. I am a professor of radiology, and I also a senior consultant at the University of Lund at the University Hospital, and also a co-director for Lund Bioimaging Center here at Lund University. And as a researcher, my main focus has been for several years now on brain tumor imaging, especially advanced imaging and treatment response. And second big topical area is autoimmune diseases with a special focus on the lupus patients.
Why did you choose to include the MDD method in your research?
Well, since I have been able to be fortunate to work with you and with Marcus Nilsson, who has introduced part of this, we very early wanted to try to see if it was feasible, especially in brain tumors, as the possibility of maybe looking into more microstructural changes in the brain tumor rather than just the conventional images.
Could you tell us about the most exciting results you so far have obtained?
Well, there's a couple of actually published papers coming the past couple of years. One of them is on the B tensor encoding, provides measures of intuitive biological markers and compositions, and that was published in 2016 by Philip Sestopankevich in neuroimaging. So that was very interesting. That was one of the first actually showing the value. And then there came a paper at the beginning of this year on the peak encoding that we can now do it in 3 minutes, which is certainly of interest if you want to use it in clinical practice. And also there is a third paper that actually is an abstract that was done by Jan Brabeck that is focused on the spheric peak encoding has the potential of better discriminate different parts of a brain tumor, especially the glioma tumors.
Are you planning to continue including the MDD method in your research? And in that case, what is your main reason for doing so?
Well, certainly I will continue to do it, as we have seen that it certainly has a potential value, and that we can combine that together with other imaging techniques to better characterize the brain tumor microstructure and the surrounding tissue. And my next project would maybe also to be looking into SLE patients to see if we could see, microstructural changes in the brain of SLE patients.
Would you find it reasonable to exchange the standard DWI and DTI protocols with the 6-minute MDD protocol for obtaining all conventional maps as well as all the novel MDD maps?
Take a whole MR study, 6 minutes is a short period and it's well worth it. And also now if we can do it already in 3 minutes, that might be even better for the clinical practice. And I think clinical colleagues will in the future appreciate it as well.
If you were considering exchanging the standard protocols, what would be the specific evidence that you personally would like to see?
Well, I would like to see that it actually holds in every patient, which means that it works every time, which we know that the diffusion weighted images do if the patients lay still. So it would be nice to have like a continuation to see that it holds. The second thing is also to maybe longitudinal see in the same patient if it repeats and you get the same values, so that you know that you can trust the measures you get to be exact and consistent, which we have in somehow found or studied previously for the ADC and FA values. I don't doubt that it will work, but I mean, if we need to have some validation before we start doing it, that would be the two things, I think.
Apart from a technical validation, you then feel you have the evidence you need to take the MDD methods to the clinic?
I would say so. I believe that it could have a clinical value, and especially if one looking into, for example, brain tumors, if you could study the microscopic tissue within the brain tumor, you could maybe see areas that are more malignant, better suited for biopsy, and other areas less malignant. So you could guide the neurosurgeons for pre-treatment, surgical planning. You could maybe also use this as a treatment follow-up, in the sense that if the patient is treated, the values will maybe normalize, and then when there is a recurrence, you will see the pathological values occur again in parts of the brain. And sometimes it's difficult with brain tumors or recurrent brain tumors to separate from pseudoprogression, and that could be another area that this might help, because that could be a clinical radiological problem to differentiate from conventional imaging.
Thank you very much for taking your time again, and I wish you luck with your continuation of your research.
Thank you very much, Karen, for inviting me for this short interview. It has been a pleasure.